Okay, guys. So we're going to go over to what your answers should have been for your research after having done looking up your information for inflammatory bowel disease. So Crohn's and ulcerative colitis. So IBD, and I want to make a distinction here that inflammatory bowel disease and irritable bowel syndrome are not the same thing. You hear a lot about IBS in the lay press and from lay people, and irritable bowel syndrome are just basically kind of having cranky guts. It does not hurt you the same way that inflammatory bowel disease does. Irritable bowel syndrome will make you crampy and have diarrhea. But if you look at somebody's intestines with somebody who has irritable bowel syndrome, they look entirely normal. Uh, if somebody has inflammatory bowel disease, you do a colonoscopy on somebody's intestines, they never look normal. At least parts of them will not look normal. And that's because you've got a completely different process going on. So, inflammatory bowel disease, you've got some kind of chronic inflammation of your digestive tract somewhere. And hopefully, in your research, you are able to identify that the two disease processes work a little bit different. Um, these definitely fall under the category of syndromes and not a specific disease. There's an unknown definite cause where we can't say where A happens and then B will lead to C will lead to D. We believe they're autoimmune, though it's probably a little bit better described as idiopathic, meaning we're not entirely sure of the sequence of events. So sometimes autoimmune means we really don't know. 10 to 20% of cases have a family history of IBD, which means the majority don't. So the majority of people who get these, it kind of pops up out of nowhere. Sometimes there's an environmental link or a dietary link. So people who have high fat diets, there tends to be a tendency for inflammatory bowel disease, but most people who have high fat diets, because here in the Western world, we don't have the greatest diets and most of us don't have IBD. These diseases tend to come on in high school years, so late teens to early 30s, so late teens to early adulthood, though there are patients that get diagnosed with these in early childhood, and there are people that come down with these later in their adult years. And these also tend to cluster in uh, families with other autoimmune diseases. So if somebody has a family history of lupus, and somebody starts having major gut issues, that's kind of a red flag that, hey, maybe there's a tip off that somebody's got ulcerative colitis or Crohn's, or if somebody's got Sjogren's syndrome, something like that. So how does it show up? Well, so these are all going to be related to somehow to having an irritable or an inflamed gut. So your intestines, as we know, are related or responsible for absorbing nutrients, digestion, and controlling waste. So if your gut's inflamed and your intestines are essentially a lining of skin, and it can no longer do its function, you're going to see problems relating to digestion and not absorbing nutrients. And anything that's inflamed has a tendency to bleed. So you're going to see symptoms relating to malnutrition and how that works. Problems that lead to that in your body, and then bleeding. So anemia type symptoms. And there can be issues that are related to autoimmune diseases that aren't specifically related to your gut. And, people who have inflamed guts are going to have pain issues. But those are the big giveaways.